Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey there, everyone. This is Dr. Burton, your host and creator of the Dr. Mama Says podcast. Well, we are well into the school year where a variety of common childhood illnesses are about to start making the rounds. And strep throat, it's a common one this time of year. Today's episode is going to deal with an unusual complication of strep known as PANDAS. As a pediatric ENT surgeon with over 30 years of experience, I've had plenty of opportunity to witness the struggle to diagnose PANDAS in kids. And of course that means I've also had to deal with incredible amounts of frustration shared by parents. Ever since I started blogging, I have been repeatedly asked to address this topic. I hesitated because from a physician standpoint, we understand the process of making a diagnosis before selecting the best treatment option. Well, because PANDAS is a syndrome and it's usually made by a detailed medical history and clinical findings, there's no one way to make the diagnosis of PANDAS. So this means that on a case-by-case basis, each potential patient who might have this problem has to be evaluated, and they often don't fit the criteria needed for a clear diagnosis. So as an aside, this is a relatively new problem. PANDAS wasn't diagnosed or identified until 1998, so there really aren't any long-term studies about children with PANDAS. But anyway, here I am, about to tackle a medical problem that many physicians or other healthcare providers don't actually all agree upon. Some don't believe it exists. That's a small group. Some believe it exists, but it's extremely rare, tending to be overdiagnosed. Yet some organizations believe that it is much more common than has been reported, and it can occur often, as many as 1 in every 200 kids. Yes, there are people who feel that there is at least one child in every kindergarten class with PANDAS. That sounds like a lot. Well, I believe most things in medicine are not black and white, but somewhere in the middle. I am trained to use science and proven treatment methods to address all of my patients' concerns, no matter what the problem is. Once a diagnosis is clear, I then need to be prepared to make a treatment plan based on it. Every medical treatment that we provide has some risk associated with it. So if the diagnosis is not clear, is it worth the risk of treatment? Herein lies the trouble with some patients that are suspected but not diagnosed with PANDAS. Well, now seems like a good time for us to all get on the same page. So what exactly is PANDAS? Clearly, I'm not talking about the cute little black and white bears that I've been using in my graphics to promote this episode, but I'm corny, so I'm going to use them anyway. PANDAS is a neuropsychiatric syndrome that is felt to be an unusual complication of strep throat, or some other infection that's caused by Group A strep. The letters in the name stand for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcus. Whew, that's a whole lot of words that means some people may have neurologic symptoms after a strep infection. Here's where it gets tricky. The exact cause of PANDAS is subject to ongoing research. There are many theories, but one of them, the most commonly accepted one, is that the immune system mounts an abnormal response to a common strep infection. The bacterium can be hard to kill because it's really good at hiding. It disguises itself so it looks like different cells in our body are normal existing cells. So the immune system eventually catches on and sees that trickster strep bacterium and begins to make antibodies to fight the infection. But because strep has mimicked other healthy cells in our body, the antibodies that we made to attack it can also attack the body's own normal tissues. In a previous post, I shared some of the severe complications of strep throat. If you've not heard that episode, I added a link to it in my show notes. And in the case of PANDAS, the antibodies attack a special area in the brain called the basal ganglia, if anybody's particularly interested, and it gives the symptoms of PANDAS. Now it's time to share yet another tricky issue with this disorder or syndrome. The exact same set of symptoms can be caused by completely different bacteria or viruses. When this happens, the disease is called Pediatric Acute Onset Neuropsychiatric Syndrome, or PANS, P-A-N-S. PANDAS has been classified as a subset of PANS because they are both autoimmune disorders that affect the brain. The symptoms are similar, but they are caused by different things, many of which are never actually identified. All right, now back to PANDAS. What are the symptoms? Well, kids with PANDAS are often reported to turn into completely different people seemingly overnight. It can be very scary, but quickly turns to frustration to many parents as they witness the struggle to accurately diagnose the syndrome in their kids. Two of the most common symptoms of PANDAS include obsessive-compulsive disorders, OCD, and tics. OCD often causes thoughts in kids that they just cannot get out of their mind. The thoughts may give them an urge to repeat an action over and over and over again. Tics are sudden movements or sounds that kids repeat and just cannot control. For example, some tics can include things like excessive blinking, head jerking, grunting, throat clearing, sneezing, or even repeating words. Other symptoms of PANDAS can include things like sudden onset of ADHD with hyperactivity, fidgeting, trouble paying attention. They can have sudden anxiety attacks or fear of being away from parents or other caregivers. There can be new bouts of depression, and also kids can start having behaviors that they had previously outgrown, like temper tantrums or baby talk or bedwetting. There can be joint pain, moodiness, irritability. They can have crying or laughing at inappropriate times. There can be a wide range of sensory problems that can occur, as well as some sleep problems. Needless to say, many children will have a large variation in the severity and number of symptoms. So all of this adds to the complicated ability to accurately diagnose PANDAS. Many different things can cause symptoms similar to PANDAS, and kids may have certain symptoms one day and completely different ones the next day. So how do physicians go about diagnosing PANDAS? PANDAS can occur to anyone, but it most commonly happens in kids between the ages of 3 and 12 who have had a strep infection within the last 4 to 6 weeks. And since strep season tends to be late fall and early spring, problems that occur during this time of year carry the greatest risk. Very little research has looked into whether PANDAS can show up in older kids or adults. But to diagnose PANDAS, your child's pediatrician will first need to take a detailed medical history. It cannot be emphasized enough how important it is for parents to provide this information, because to diagnose PANDAS, a clinical diagnosis must be made first, then later it's supported by tests. When a suspicious clinical history is obtained, a physician may then take a throat culture to see if strep is present, or run a blood test which might show whether or not your child had a recent strep infection, even if it's not clinically active or giving any symptoms. And it goes without saying that simply testing positive for strep does not mean the diagnosis is PANDAS. Remember, there is a really, really important emphasis on the clinical diagnosis. Also, I have to add that the strep infection can be located in another area of the body besides the throat. That just happens to be the most common site. If strep is not shown in the throat swab, physicians might check other places where strep tends to hide, like in the sinuses or the child's bottom or even in the genital area. Without a positive strep culture, it's extremely difficult for physicians to proceed with this diagnosis. However, there is no one laboratory or neurologic finding to specifically diagnose PANDAS. So if you remember nothing else about this episode, that's the take-home message. The National Institute of Mental Health has introduced some guidelines for diagnosing PANDAS, and of course I added a link to that in the show notes. Some of the criteria that they listed include having the presence of clinically significant obsessions, compulsions, and or tics. I just discussed those. Also, it's usually an abrupt onset of symptoms or a relapsing course of symptoms. Symptoms should first be identified between the ages of 3 and puberty, although, like I've said, it's unclear how often it can happen in teens or adults. There needs to be documented presence of a strep infection and also some combination of other neuropsychiatric symptoms. The emphasis on finding a strep infection is extremely important. If a child does not have strep, the child does not have PANDAS. Yes, I'm going to leave it at that, but there are people who believe that it can still be PANDAS with hidden strep, but beginning treatments for PANDAS without a diagnosis of strep, not recommended. Before I end this episode, I want to share a little editorial, just a little insight that I think might be helpful for parents to understand our immune system. Strep is a very common illness which many kids get every single year. It's usually harmless and easily treated. However, there are some kids who develop severe complications that sometimes lead to permanent consequences. These unfortunate situations do not mean that the strep bacteria has somehow become a much more sinister or aggressive bacteria. It is simply the result of an individual immune system having an unusual reaction. This can happen with anything in our environment. Allergies are an unusual reaction of an individual's immune system to things that most of us can tolerate. I mean, it's just a tree, it's a cat, it's dust, it's a peanut. I mean, for most of us, these are all uneventful things to interact with, but for other people, it can cause significant disease. So of course I'm going to add that this abnormal immune system reaction can also be a situation where parents report unusual neurologic reactions to vaccines, medications, or procedures. Vaccines are incredibly safe and effective and have been enormously successful in improving global health. I've already shared one of my previous posts where I highlighted my experience watching vaccines save lives. This is one of those times when being old, or maybe I should say seasoned, gives me a little bit of an advantage of living through the history. If you've not read the post, be sure to check it out. I added the link in my show notes. Anyway, vaccines do not cause autism. They do not lead to the development of the disease it's intended to protect against. Vaccines are safe and should be used as recommended by your physician, period. Everyone needs to understand that healthcare is based on understanding that physicians must use scientifically backed evidence to determine what is an expected result versus an isolated individual response. Physicians are well trained to understand what the typical immune system reaction to any given environmental change should be. Autoimmune and other abnormal, atypical immune reactions are entirely individual results which will be managed with the best possible treatments. These unusual immune reactions are often based on genetic predispositions or an underlying health status which can lead to consequences that are not predictable. Now, what about PANDAS treatment? Surprise! I'm actually not going to discuss PANDAS treatment right now because I want everyone to take a minute to digest the information that I just provided about the difficulty in the process of diagnosing PANDAS. In my next episode, I'll take this information to the next level and begin the discussion about how PANDAS treatment is also controversial. I will also shed light on the fact that the cost of treatment for some children is so high that the diagnosis and treatment of PANDAS mostly occurs in wealthy children. But that's a discussion for another day. This looks like a great place to stop. For now, I gotta go. Thanks for tuning in. Until the next time.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to Apple Podcasts or wherever you go to listen to your podcast and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in any episode, a summary of the show can always be found online at drmamasays.com. Also, don't forget to subscribe if you've not done so already. Hope you come back and listen again soon.